Thank you, Alice, for highlighting some of the key recommendations of Speech Pathology Australia's clinical practice guideline that will be pertinent to take into consideration for clinical practice. It is the position of the Association that speech pathologists working in AAC engage in ongoing professional development and seek professional support and supervision as required. Whilst this is a key element of practice across all fields in speech pathology, we have attempted to include this recommendation in our resource by providing links and suggestions for ongoing support and development. It is imperative that speech pathologists continue to seek these supports to develop their professional competency and support clients and their families with best evidence in AAC service provision. One of the fundamental recommendations in Speech Pathology Australia's Clinical Practice Guideline on AAC states that it is essential that speech pathologists working collaboratively as part of a team using a person-centered approach in the field of AAC. This recommendation is the primary factor in the development of our resource for new graduates. The primary aim of a person or a client-centered approach is to gear therapy to target the needs, wants, and wishes of the client. In the context of speech pathology practice, this means putting in place services that are going to benefit the client and their significant others to increase communication outcomes. This includes tapering intervention and outcomes of the wishes of clients and potential family and caregivers. This was the catalyst for the creation of the resource. The document aims to champion the client-centered approach to illustrate to new graduates and clinicians without experience in AAC that this is the most appropriate and beneficial approach to this field of practice. One key element of the person-centered approach is the need to set and implement functional goals as opposed to impairment level goals. This may be explained with an example. A functional goal for a nonverbal client post-stroke would be to return to a social group and be able to communicate effectively. An impairment goal, however, may be to use switch access to indicate accurately yes/no response 100% of the time. Impairment goals may assist you to achieve functional goals, however, they should not be the target in a person-centered approach. Functional goals should be set as per the client's wants, needs, and wishes in collaboration with the treating team and significant others. The importance of setting functional goals is underpinned by the notion of quality of life. The World Health Organization defines quality of life as individuals' perception of their position in life in the context of the culture and value systems in which they live, and in relation to their goals, expectations, standards, and concerns. It is a broad-ranging concept affected in a complex way by the person's physical health, psychological state, level of independence, social relationships, personal beliefs, and their relationship to salient features of their environment. Working collaboratively as a team is another fundamental aspect of a client-centered approach. The views, opinions, and expertise of a multimodal and disciplinary team can provide information that is imperative to implementing the most appropriate AAC services to suit the needs of the client in terms of meeting their clinical presentation. Other members of the collaborative team may be occupational therapists, physiotherapists, and teachers. However, a professional team is not the only expert team whose opinion should be sought. The views, opinions, and information provided by the significant others of the individual are imperative to the good implementation of AAC services. Research suggests that when AAC services and devices are implemented with the assistance of family members and significant others, the services and devices are more likely to be used. For example, if the individual's main communication partner is provided with knowledge of how to use a device effectively, then they are likely to use the device more effectively. They may also then be more involved with the choice of the device in terms of cost and accessibility. The resource aims to highlight the importance of using a team approach in AAC service provision, especially key communication partners and family members. I will now pass you over to Victoria and Cara, who will take you through the resource we have developed for new graduates.